Hello, good morning to you, class. Today, I'm going to be teaching you BST as well, BSTA. So, I want to talk about non communicable diseases and their prevention. The first thing that comes to your mind, what do you understand by the word non communicable diseases? We have first talked about communicable diseases. When we're talking about communicable disease, it means the disease that can be transferred from one person to another. That's what we call communicable diseases. But now we're talking about non communicable. We're talking about word and opposite. Is the opposite of that, which means these are diseases that cannot be transferred. These are the diseases that cannot be contracted from one person to another. So that one is called non-communicable disease. Like what the notes I gave to you, I said that non-communicable disease are diseases which cannot be spread from one person. That is, this disease remain confined to the diseased person and do not affect others by contact or by carriers. Not because you are close to the person, you'll be infected, or not because the person just sneezes, you have it. No, they are non-communicable diseases. So we'll be talking about, we have different examples of it. Though I've given you those ones there, but I'm going to add to it while I'm explaining to you. But I'm not going to write those words down for you. But I want you to listen attentively. We have different examples of it. We have the sickle cell, we have the obesity, we have the asthma, we have the anemia, we have the kwashiorkor, we have the diabetes, we have hypertension, we have heart disease, we have stroke, we have cancer, we have asthma, we have osteoporosis, we have the arthritis, we have chronic kidney disease. All these are examples of non-communicable disease. It cannot be passed from one person to another as a result of contacts or as a result of sneezing. So I'm asking your test or any of your examination that should tell me or list 10 examples of disease that are not communicable. Though what I've given to you now is over 10. I can ask you to mention 10, I can ask you to mention 5, so you must be able to tell me. So what we know as what we call non-communicable diseases. So though I will select part of it, which I'm going to explain the meaning, how it can be prevented, and how it can be cured. Now let's talk about the first one, sickle cell disease. That one is majorly common, especially for those who do not go for medical checkup to confirm their status. AS and AS cannot marry. Once AS and AS marry, there will be a problem. There's probability of giving birth to SS. Though in the process, they can have what we call AA, AS, AS, SS, which means they have 25% of giving birth to SS. So we don't need to play any games at all. Let's try to avoid it. Once the person is AS and you also are also AS, don't bother to go into marriage. Forget about it because there's tendency for the person to give birth to SS. Now, coming back to this, we said it's a hereditary blood disorder characterized by an abnormality in oxygen carrying hemoglobin molecules in red blood cells. This leads to a propensity for cells to assume an abnormal rigid sickle cell shape under certain circumstances. Sickle cell disease is associated with a number of acute and chronic health problems such as severe infection, attacks of severe pain, stroke, and there is an increased risk of death. So anybody that is SS, they belong to what we call sickle cell disease, and it's very easy for them to die at 10 because they don't even last long. Only a few of them they can make it to 50 years, and at any time they can pass it. It's not a matter of there's no way said by miracle saying that the person is SS and it's now 100 years or 80 years. No, it's very, in fact, I've never seen that. Anyway, so how can we avoid all this problem? Let's talk about the symptoms, the symptoms of sickle cell disease. One, there will be stroke, which can result from progressive narrow of blood vessels. That is, the blood vessel will become narrow. That is when they say narrow, where the blood is supposed to flow through. The blood will not be able to flow through it. So I can prevent oxygen from reaching the brain. When the oxygen did not reach the brain of the person, what do you think will happen? The person will have stroke. So that's just due to central infraction occurs in children and cerebral hemoglobin in adults. What does about the cerebral? Cerebral is talking about the seat of reasoning, seat of intelligence. Once that seat is being affected, because the blood could not flow to it, you discover that the brain will not be able to write, and you discover that the person will not be able to walk very well again. Part of the body will be shifted. So another thing again, symptom, there will be silent stroke, causes no immediate symptoms, but associated with damage to the brain. Silent stroke. So it will require the person not be able to respond the way it's supposed to respond. Another thing again, there will be what we call leg ulcer. You should be able to differentiate between the ulcer and cancer. So what talking about leg ulcer, that is the person will have what we call chronic pain in that very particular place. Chronic pain, wound there. But cancer, that's outgrowth, ulcer, the wound, and that wound will be chronic. So the symptoms include shortness of breath, decreased exercise tolerance, and so on and so forth. Which is why the person will not be able to breathe very well. But how can we prevent it? That's the question. It can be prevented. One, vaccination and preventative antibiotics. That is, you protect against infection that trigger crisis. Because this thing is already there, but you can prevent it so that the person can live longer. Blood transfusion. So once the blood is being corrupted, blood transfusion can be carried out, removing the blood that is there before, replacing it with another one. Another thing is drug therapy. So the person continue to use drug frequently so that it will be able to last long. Now, another thing, another example of the non-communicable disease is obesity. Once you hear the word obesity, you're talking about a person who is over fat, the person that is very, very fat, extremely fat, and from there it's affecting the heart. I know that there are blood vessels that carry the blood in and out of the body. So once the person is obese, we discover that the vessels that are responsible, we have three vessels in the body precisely. We have the capillary, we have the artery, and also have the veins. Once person is obese, we will discover that the 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 capillary will not be able to carry the blood very well. We call them vessels altogether. And once you could not circulate the blood to the heart, you could not bring the blood out of the heart very well, there will be crisis in the person. So what I'm talking about obesity, I've explained to you now. So what will happen? What are the causes of obesity? Now, we say wrong dietary habits. When the person does not eat the right food, you must eat the right food for you not to be obese. As I've said it before, the person must eat very well. But why we are going to eat the right diet? Those ones that are obese eat wrong dietary food. How? They eat a lot of food that has fats, while some of them will eat fried food. A person that is getting fatter and fatter and still continue to eat fried food, the person is only destroying his or her life. So should abstain from fried food. Another thing again is animal flesh, that is especially the red meat, sweet junk food, and alcohol. All those things can cause what we call obesity. Another thing, less physical activity. Doesn't go out for exercise. Hmm. When you don't go out for exercise, any little thing you want to take bus, you want to take car here and there, and obese must learn to do exercise to reduce. Another thing again is that can cause it is hormone variation. That is caused by certain drugs or medicine. When there are some drugs that when somebody take it, it can change, it can affect the hormones and start to make the person to increase in size. Those are the things that can cause obesity. Another thing again is genetics. Some are inherited from their parents. So once it is inherited from the parents, you discover that the mother is fat, the father is fat. So there is almost 100% that the child can also inherit the obesity. But what the child needs to do is to do exercise, to do one or two things to avoid the obesity. Another thing there, now we have here that is prevention and control. How do we control it? We have talked about the causes of it. So in the process of explaining causes, I've explained also control. And what are the control? An obese person should avoid fried food. Any food that is not good for the body should avoid it. Fried food, junk food, all those food that will not assist the system, they should avoid it. Any food that is having too much of fat, they should avoid it. Number two, an obese person should regularly perform physical activity, avoiding to avoid sedentary lifestyle. That is to avoid anything like have a kind of sediment of food. So you should continue to do what we call exercise. That's what can help an obese person. Another thing, an obese person should strictly take balanced diet with very less amount of carbohydrate and fat. Those that accumulate to obesity are the majorly carbohydrates, fats, carbohydrates and fats. When you take too much of those things, they can make a person become obese. So another thing there is an obese person should avoid junk food as that contains especially the calorie, those hamburger, all those things should be avoided. Another thing again, an obese person should eat a lot of fibrous food like fruits, salad. While eating such one, they'll be burning out all those fats in the body, vegetables, and so on and so forth. These are the things they need to eat to help their body. Now we'll move to the next one. Another disease under the communicable disease that cannot be passed to somebody. So now let's talk about next one, asthma. When we're talking about asthma, we're talking about the person who is suffering from coughing and how will that will happen and how did it happen? So it's a chronic condition in which airway is being blocked or is becoming narrow from the lungs. And when the person cannot do it very well, it's called that once everything is narrow, when we talk about lungs is the major respiratory organ, not the nose. Nose is just a passage. But some of us are mistaking nose for the major respiratory organ. No. The respiratory organ is the lungs, while the nose is the passage of the gas. We breathe out oxygen and we breathe out carbon dioxide, we breathe in oxygen. So the function of the nose serves as a passage, but the respiratory organ is the lungs. So let's take note of that. So while I continue, so I said that it is a chronic condition in which the airways that carry air to the lungs are inflamed and narrowed. When I say inflamed, become bigger, and the space at which the hair is supposed to pass through is becoming narrow and narrow. And at the end of the day, the person is asthmatic patient. So the person continues to use inhaler just for the person to survive. And okay? What are those things that can trigger, such as substances that are inhaled? Common asthma triggers are tobacco, smoke, dust, or we have the dust, where we have the pollution, cold air, and so on and so forth. When we have all those things, they can trigger what we call asthma. So an asthma patient should not stay where they are even frying something like, let's assume now, the palm oil, where they're trying to bleach it. Such a person must not stay close to it, or where they are using chalk, or where anything that it can cause dust. An asthma patient must avoid such places. Now, what are the symptoms? There will be continuous coughing. So the airway are irritated. That's what causes the coughing. So your body tries to clear them by coughing. You want to clear because something is like something is covering it. You are feeling irritated. That's the reason the cough persisted. And it cannot be transmitted to any other person. So no matter how it happens, it's not possible. That's we call them non communicable disease. Another symptom is chest tightness. We discover that the muscle around that place will be very tight, and we discover that the person want to do it by force. That's to say that muscle around airway tighten, making your chest feel squeezed or heavy. You want to do it by force, but it's not coming out. Another thing, the wheezing or whistling sound from the narrow airways. It makes a kind of special sound. because you just want to force it out. Number four, there will be trouble in breathing. The person will not be able to breathe very well. Let's here get through due to swelling and mucus because there's swelling in the passage. So, and how can we control it? Avoid asthma triggers. When I say avoid asthma triggers, that is those things that can cause you, that can make you to continue to cough, or they can affect you. Where we have the dust, where we have the bleaches of palm oil, or different things, anything that can cause it. Such a patient should avoid that area. Another thing there is take a quick relief control medication. There's no way once you know that an asthma patient, there will always be a particular drug that you'll be using. So you should quickly take that to avoid anything that can cause more of problem to you. Alright, take a long time medication, that is daily inhale the corticosteroid to reduce airway inflamed and make airway sensitive. So continue to use your inhaler to clear everything so that there will not be any problem. And you must go with your inhaler anywhere it's going to. You must not leave it at home and say, I don't want them to know. Hmm. Life has no duplicates. So the such a person must hold the inhaler everywhere. So another thing again, talk with doctor regularly. What you are feeling, let the doctor be aware of it. Don't keep secret to yourself. Don't feel inferior. No. Now the next one is the anemia. What about anemia? When your blood does not have enough healthy red blood cells. When there's no enough red blood cells, I mean the red blood cells is not healthy, it can cause what we call anemia. So, or which is known as red blood cell, which is known as hemoglobin. So that's why we have what we call the red blood cell. So this disease caused due to deficiency of mineral. And what does that mineral? The mineral precisely is the iron. So when the iron is not present, when we don't have enough of iron in the red blood cell, it will form what we call anemia. There will be shortage of blood, and we can also make the person look pale, look fat, losing weight as well. So what are the symptoms? One, an anemia person feel tired easily. Why? Because there's shortage of blood. Two, there will be loss in weight, continue to reduce in size. Another thing again, poor look pale. You will discover that he will not look, he will look as if it's white because there's shortage of blood. There will also what we call the breathlessness occur. The person will not be able to breathe very well because the blood we are saying is the major cell in the body. It carries every part of functions, every other functions in the body is the blood that carries it. The hormones is the blood that carries, and we're talking about the hormones from the brain is the blood that will circulate everything. And when blood is faulty, there will be problem. And all those things cannot be transferred by contact or by anything to any person. So take note, they are all non-communicable disease. Now, how can we conquer it and how can we prevent it so that it will not kill us or control? Eat iron food, those iron that is rich. Eat iron rich food. One of those things are this: eat red meat, the Spanish, fortified cereal, and liver. Those are the things a person needs to eat. A person who is suffering from such problem. So we should eat all this so as to be able to look stronger and the blood can be supplied. And all this they have iron in them. Number two, prevent blood loss and infection. Any cut like this, make sure you quickly cover it so that it will not lead to problem. Because when there's shortage of blood, there can be loss of life. Number three, supplement and screen. That is iron folate tablets during pregnancy. We should be deworming and we should do what we call regular deworming and regular CBC. What I mean by CBC? It means complete blood count. Go and check on your blood so that you know whether you're having shortage of blood or not, or else somebody can just die one day because it's not doing the right thing. So there must be what called CBC, meaning complete blood count. You check for the kids, teens, and pregnant people. You continue to check yourself to confirm. Another disease there again is kwashiorkor. Kwashiorkor cannot be contracted as well, just like what I've said. It's a form of severe protein energy malnutrition. Such a person is suffering from major protein. Kwashiorkor usually set in children between the age of 1 to 3 when there is daily intake of protein is less. But when there's no daily intake of protein, there's risk of kwashiorkor. And what are the symptoms? There will be boggles of eyes. The eyes will be swollen and the eyeball will be showing very well, as if the eyeball want to fall. Two, there will be stunted growth. The growth will be very poor. Three, there will be skin. The skin becomes scaly. That is almost peeling off as if it's a fish, like all those tilapia fish, and peel off simultaneously, continuously, because there's what we call lack of protein in the body, which leads to what we call kwashiorkor. Four, swollen abdomen. You see that long neck, tiny neck with swollen stomach. Know that he has eaten a lot because of the condition. Two, hair becomes reddish before the age of 5 years. It will look as if it's tinted, everything because of lack of protein. Six, brain development retarded and affected. We discover that there will be what we call deceleration, retarded of the brain. The brain will not be able to think well because of the condition. Now, how can we control it? Add protein early. Add protein early. We said that we should add, hair becomes reddish before the age of 5 years. Brain development is retarded and affected. The thinking will be very poor. If you don't, so the person will not be able to think very fast. Now, what are the ways of controlling it? One, add protein early. As the child is growing, let the child be eating more of protein so that the brain can also be developed, well developed. Diet diversity. So no, you don't just key to only one class of food. Let there be diversity of food. Protein, carbohydrate. We say, oh, what of carbohydrate? But when there's too much of carbohydrate, we play, no. They should eat carbohydrates as well. Also eat protein. Because that carbohydrate is one who gives energy. Fat also gives energy. So those are the things that is needed in the body. Not that you concentrated on only carbohydrate and fat. When you consider that and then you do not take what we call protein, then what we call kwashiorkor. Now, the next one now, another thing that can use to prevent it. Treat illness and educate. That is, you tell people, you educate people on what to eat, on what to do about their health. Now let's talk about the next disease. That's Marimos. That's another disease. Marimos is a form of severe protein energy malnutrition. And this one too. When there is deficiency of protein in the body, it also affects as well. So it happens when someone does not get enough calorie as well. Protein and overall nutrition for a long time. The body starts breaking down its own fat and muscle for energy, for survival. So now, what are the signs and symptoms of the Marimos? There is extreme weight loss. That is, it will affect the skin and bones. Two, there will be muscle wasting and loss of body fat. The person start to shrink. Three, there will be dry, lost skin that hangs in fold. Four, weakness, fatigue. Person become weak and doesn't have strength. And low body temperature. The temperature start to decelerate. Normal temperature of body is 37 degrees Celsius. It can also be 36.5 and so on and so forth. But it's not be more than 37. When it's around 38, there's problem. But 37.5, 37.4 is still better. 36.5 is still better. But when it's going down, there's a problem. When it's going up, there's a problem. But in this case, the body temperature become lower. You'll be going to 35, 34. There's a problem on that. So another thing again is retarded and mental growth. We call that the what we call retarded physical and mental growth. The person will not be able to grow very well, and the brain will be affected. When others are thinking fast, this are supposed to provide the solution. Such a person will not be able to think right because of the problem of the marriage months. Now another thing is what we call digestion is impaired. Which call that it's not the digestion is in the body is not perfect. We would call that such a person will not be able to digest the food, all those things that's in the body, the colon, which is the large intestine and the small intestine, will not be able to digest it very well, which can make the body become heavy. Another thing there again is body becomes susceptible to infection. That is, it's easy for the body to start to have infection because the body is exposed. So those are the things that someone will be experiencing when it's not taking the right thing. Now, let's talk about the prevention and control. How can we prevent it? You eat the adequate nutrition, that is adequate nutrition, majorly protein and calorie. Another thing again, early digestion, regular growth and monitoring and weight check, especially for kids. So it's best to eat early so that we early digestion. Another thing, food security. What is by food security? Improve access to diverse and affordable food. It's not until you have a lot of millions or a lot of money before you can eat balanced diet. There are some things you can eat gradually to help the situation. We have orange, we have some things that are not even expensive, you eat them so that the body can keep going. Manage illness. Once a person is having such a thing, you need to continue to manage it. You eat the right thing at the right time and you treat yourself at the right time. It's like look at manage illness, like treat infection, diarrhea, sick person need more calorie. Sick person need more calorie. Now we have 10 exercises. I want you to go and study it carefully and answer it. And I want you to still give me, apart from the one that is in your lesson note, and I want you to give me 10 examples of non-communicable diseases. 10 examples. I want you to give to me. You send it to me individually. Don't send it to the school phone. Don't send it to the GSS2 platform. You send it to my phone number directly. So I don't want copy here and there. You do that from your house. So send the 10 examples of communicable diseases. So if you have any question, you can also send your question to me. I will attend to it. So we have 10 objective questions there. So all those objective questions have been given to you and the theories there, please try to study it so that you'll be able to answer your tests very well. So if you have any other thing, you can as well ask me.